All right, welcome back. And again, this is Dr. Sharawi. I'll be talking about the respiratory system today. It's a very nice and easy system. It's the main components or how the air would pass through the respiratory system. We have an upper respiratory system and a lower respiratory system as well. So again, the upper respiratory system, so anything above the pharynx. Anything below the pharynx is called the lower respiratory system. So let's go ahead and speak initially about the upper respiratory system. So the nose itself, then we have the nasal septum, which is kind of subdividing the nasal cavity into right and left nasal cavity. And it is the septum that's present between the right and left nasal nostrils itself. So this is the external nares. This is the internal nares. This whole cavity is called the nasal cavity. Keep in mind that the nasal cavity is separated from the oral cavity through the nasal, through the hard palate. This is the uvula or the soft palate. And within the nasal cavity itself, we have kind of a turbulence, like bony turbulence, called the conchae or the conchae. So we have the superior nasal conchae or not conchae, then we have the middle and the inferior nasal conchae. Now, what's the main importance of those conchae is just to allow humidification and warmth of air that we breathe in. All right, especially if the weather is really cold. Then we have the different regions up here. So we have the nasal pharynx, we have the oral pharynx, and the laryngeal pharynx. So the laryngeal pharynx is close to the larynx itself. The oral pharynx is close to the oral cavity, and the nasal or the nasopharynx is close to the nasal cavity as well. Okay, so this is the hyoid bone. This is the cricoid cartilage. Then we have different rings or the tracheal rings. It's about roughly 25 rings. It's a fiber cartilage. Then they will be subdivided into the right and left primary bronchus at the location of the carina itself, C-A-R-N-I-A, and that's the bifurcation or the division of the terminal portion of the trachea itself. And eventually, if we have a primary bronchus, it will subdivide into secondary bronchus, and the secondary bronchus will subdivide further into tertiary bronchus as well. So we have the primary, secondary, then tertiary bronchus as well. Then we have the terminal bronchioles, and along within the terminal bronchioles, we will have the alveolar or the alveolar sac as well. Okay, now the main muscle of respiration is the diaphragm muscle, which is being supplied by the phrenic nerve, C3, 4, and 5. This is very important because it's the main muscle of respiration. Now let's move along and look into our module here. This is about the same thing. This shows us the nasal cavity. So that's the nasal cavity. And I would actually say that the whole thing is the nasal cavity. And again, we see the superior, middle, and inferior nasal conchae. And number 2 will be the nasopharynx right there. Then we have the oral pharynx. It's related to the oral cavity. Then we have the laryngeal pharynx. Now, afterwards, we have a cavity over here. It's called the laryngeal cavity because it's just a space right there. Then we have the trachea itself, which is the windpipe. And eventually we have the right main bronchus and the left main bronchus. We see that the right is kind of horizontal in a way, and actually it's more oblique, and that's where it's more common to have food being impacted or choking if we have choking of food or drinks. Kind of an aspirate as well. Now we have, afterwards we have the primary bronchus, then we have the secondary bronchus, and you see over here the tertiary, 1, 2, 3, tertiary bronchi or the bronchus. Then we have the terminal bronchioles as well. All right, now what's happening here in this section is that we're getting number 12 is the terminal bronchiole, Okay. Now, what is the orange colors over here? Those are kind of strings of smooth muscle. Now, to see over here, the windpipe is a cut section. That's whenever somebody has asthma. What's happening is that you have inflammation of the epithelium itself right here. Not only that, you would have these muscles kind of spastic, so they would narrow down the windpipe itself. Eventually, they would have a wheezy sound, kind of a wheezy sound that will indicate that the lumen is kind of narrowed as well. Okay, so let's go ahead and take a look at our respiratory bronchiole. Then this is the alveolar duct. This is the alveolar sac. And if you look over here, this is the number 16 is the pulmonary alveoli. And we see that we have lots and lots of different capillary plexus, and that's where the exchange of oxygen and carbon dioxide will take place. All right, so the blue thing, this is kind of a deceiving portion. Now, number 17, which is the pulmonary artery, carries deoxygenated blood, while the vein, it's called the pulmonary veins. And remember that we have the pulmonary veins carry the oxygenated blood, and this is the exception to the rule. As you guys recall, we have two pulmonary arteries from the heart itself, and they're carrying deoxygenated blood. Let me go ahead and take a look at here. So basically, I think it will be within the heart module. Let me go ahead and grab it pretty quick. All right. So briefly, again, this is the pulmonary trunk, and the pulmonary trunk will have a right and a left pulmonary arteries. This is a right, and this is a left pulmonary arteries, and this is an artery. It's an exception to the rule that this will be carrying deoxygenated blood, which is less blood or less oxygenated blood flow, while we have the returning veins from the pulmonary circulation, and this is called the four pulmonary veins, which are oxygenated blood that would open up into the left atrium. All right, so this is just kind of a brief review about the pulmonary circulation or the pulmonary system. Now, let me go ahead and speak about the different fissures or the different lobes that we have within the lungs. Now, again, this is the diaphragm muscle, the main muscle of respiration. Keep in mind that this is the apex of the lung. This is the base of the lungs. Again, this is the apex of the lung, the white thing portions over here, and that's the base right there of the lung. This angle is called the costophrenic angle. So its name applies or implies from the costal cartilage and the phrenic nerve that supplies the diaphragm muscle. Now, this is the angle where we have excess fluid. Let's say somebody had a traumatic car accident or a blunt trauma, then they would have oozing of different fluids over here. Most probably, since it's traumatic, there will be some rupture of the ribs itself, and that's well blood. It's called the hemothorax. Now, if we have transudate basically it's kind of a fluid or a serum actually. That will be collected within the costophrenic angle. That's non-infectious, but if it was infectious, it will be called exudate. And exudate is very rich in proteins because of infection and how the white blood cells will interact as well. Definitely, if we have something called the pneumothorax will be air level. Okay, that's on an X-ray. This will appear kind of pitch black as well. If we have a water level, then that's where we sample, or we kind of know from history or from the clinical scenario what happened, and we will kind of detect that. Most probably it's bleeding or whatever sort that is. But if we have an infection secondary to pneumonia, we could actually see the bronchomuscular junction. Actually, this requires an X-ray, but I'm just doing flashbacks of X-rays in my mind. So you guys could definitely look into it. And if it's atelectasis, it will be small portions of the lungs right there. There's lots of things going on. Now, one important thing, keep in mind that the apex, we spoke about the apex of the lungs right here. We have the collarbones, which is a clavicle. Those are the clavicles right there. This is the clavicle. It's called the collarbone. Okay, now this is similar to that module over here. And keep in mind that the collarbone kind of protects the apex of the lungs right here. So that's where the apex is. So if we have a very strong fall or a traumatic accident and the collarbone is fractured or injured, what will be the underlying structures right there? See over here? What will be the underlying structures? Well, let's open up and find out. Okay, so let's remove this. Okay. So this is just a cut section for the collar, for the rib itself, the collarbone right there. So the underlying structures, we have the apex of the lung. Not only that, now we have the subclavian vein. Not only that, then we have the subclavian artery as well. So in other words, if we have a collarbone fracture injury or damage, we would have liability of having our lungs damaged and the subclavian artery and veins damaged as well. And that's where there's something called crepitous, or basically it's air underneath the skin that's already popping from the lungs appearing. So this is a very strong clinical scenario, and it's a board question as well. Please keep in mind, always have clinical scenarios in the back of your head while you're studying anatomy and physiology. That would help you with your career big time. Okay, I think that should be it for this portion, but still I just need to recap or cover the fissures within the lungs itself. Now again, this is the right lung, this is the left lung. Now the right lung, if you see over here, we have different fissures. This is called the horizontal fissure, and this is the right oblique fissure that would kind of separate the lung into three different lobes. We have the superior lobe separated from the middle lobe by the horizontal fissure, while we have the right oblique fissure separated by separating the middle lung from the middle lobe to the compared to the inferior lobe of the lung. Not only that, if we look into the left, we have only one fissure that's separating or subdividing the superior lobe of the lung from the inferior lobe of the lung, and that's called the left oblique fissure. So please keep in mind, don't say just an oblique fissure, because we have a left oblique fissure and we have a right oblique fissure. All right, now what is this? This is called the cardiac notch right there. So this left lung is smaller than the right lung because it would have a notch right there, which is the cardiac notch, to allow facilitation of the heart itself, as we see. All right, so this is the bronchovascular or the pulmonary circulation. Now this is a perfect view. We have different systems within our body or circulatory system. We have the pulmonary circulation, that's where the exchange of oxygen and carbon dioxide that takes place. And we have the systemic circulation, systemic circulation, that's where the systems will be fed by the arteries throughout the whole systems of the body. And keep in mind that the oxygen saturation pressure before it reaches the alveoli, it will be about 40 millimeters mercury, and after it passed through the alveoli, it will be 100 millimeters, and eventually that's the oxygenation process, while the carbon dioxide level drops from 45 millimeters mercury to 40 millimeters mercury after passing through the alveoli and the oxygenation process. All right, hopefully that this video kind of helped you guys through the pulmonary circulation, and it kind of help you guys through the respiratory system. And I'll definitely go over the circulatory system and pretty soon with the heart as well. Thank you. Have a wonderful day. Hopefully you guys enjoy and like the movie.